Welcome to the Health, Balance, and Wellness channel. Your oasis of peace. Starting at age 40, the kidney's ability to filter blood tends to naturally decline by about 1% per year. If you do the math, you realize that by age 70, you might only have 70% of the functionality you had in your youth. The worrying thing is that, in most cases, you don't notice it until the situation is already advanced. Every year, kidney cells lose some of their ability to filter toxins and waste. Month after month, a small amount of unwanted substances remains in the body. It's a silent and gradual process. Waiting too long means moving from prevention to management of an already established disease. The good news is that if you act now, you can slow this decline. Complex or expensive therapies aren't necessary, for vitamins, incorporated into your daily diet, can help keep your kidneys cleaner, more efficient, and more resilient over time, reducing the risk of needing dialysis. Before we move on, I'd like to ask you to support our work. Let's get back to the video. These vitamins work in different ways. They protect tissues from oxidative damage, regulate blood pressure within the kidneys, prevent calcium from accumulating where it shouldn't, and strengthen natural barriers against toxins. Let's look at them one by one. Vitamin D, the silent guardian of the kidneys. Many associate it with bone health or a good mood during the winter months, but vitamin D also plays a crucial role in protecting the kidneys. It acts as a shield that defends cells from inflammatory molecules called cytokines, blocking them before they can damage tissue. It stimulates the kidneys to produce their own antioxidants, which neutralize free radicals and prevent cellular degeneration. It also manages the proper use of calcium. Instead of allowing it to deposit in the renal blood vessels, it directs it to the bones. Another benefit is its effect on blood pressure. It regulates every hormone that controls it, reducing stress on the kidneys and preventing damage to the renal filters. Furthermore, it prevents the formation of irreversible scar tissue within these filtering units. With age, however, skin production of vitamin D declines dramatically, and the kidneys become less efficient at activating it. It's best to consume vitamin D3 with foods containing fat to aid absorption: eggs, avocado, nuts. Among the richest food sources are salmon, trout, sardines, eggs, fortified milk, and UV-exposed mushrooms. Cod liver oil is also very rich, but the flavor isn't for everyone. Alternatively, a daily supplement remains the most practical option. It's important to consult your doctor. Vitamin E, the external protection of kidney cells. Vitamin E is a powerful fat-soluble antioxidant that integrates into cell membranes, forming a protective barrier against free radicals. Essentially, it prevents them from damaging cells and compromising their function. It also promotes autophagy, a cleansing process within cells, through which they eliminate damaged tissue and regenerate. It protects the capillaries that carry blood and nutrients to the kidneys, preventing the oxidation of LDL cholesterol, which can clog them. This vitamin requires healthy fats to be properly absorbed. If you follow a diet too low in fat, you may not get the benefits even if you take supplements. Among the best sources are wheat germ oil, sunflower seeds, almonds, safflower oil, spinach, avocado, sunflower oil, and hazelnuts. The average daily requirement is about 15 milligrams. It's best to choose natural supplements over synthetic versions, and take them along with vitamin C to enhance its effect. However, care must be taken not to exceed 1,000 milligrams per day to avoid interference with blood clotting, especially if you are taking anticoagulant drugs. Vitamin A, the barrier that blocks toxins. Generally known for its role in vision, vitamin A is also essential for maintaining the integrity of the intestinal lining. This layer functions as a filter, allowing nutrients to pass through but retaining harmful substances, such as oxalates, from reaching the kidneys. When vitamin A levels are low, this barrier becomes permeable, and any oxalate can accumulate in the kidneys, promoting stone formation. Vitamin A also helps produce citrate in the urine, a substance that dissolves minerals and prevents crystallization. There are two main forms: the preformed one, present in animal foods, liver, eggs, and easily assimilated, and provitamin A, present in orange and green leafy vegetables, carrots, sweet potatoes, kale, which the body must convert before it can be used. The daily requirement is approximately 900 micrograms for men and 700 micrograms for women. It's important to take it with zinc and fats to optimize absorption. Those with chronic kidney disease should exercise caution, as vitamin A can accumulate in the body if the kidneys fail to eliminate it. Vitamin K2, the calcium traffic director. Often overlooked, vitamin K2 is responsible for directing calcium toward bones and away from arteries and soft tissues, including the kidneys. It activates proteins that capture excess calcium and transport it where it's needed. Without enough K2, calcium can deposit in the kidney's blood vessels, reducing blood flow and damaging tissue. Over time, this increases the risk of kidney failure and other complications, such as calciphylaxis in dialysis patients. K2 deficiency is common, especially among the elderly and those taking long-term antibiotics or blood thinners. The richest source is natto, fermented soybeans, but aged cheeses such as Gouda and Edam, chicken liver, beef, free-range egg yolks, and sauerkraut also contain significant amounts. The recommended daily intake is 90 to 120 micrograms, but some studies suggest that higher doses may be beneficial. The 7 Malawian kwacha's form is preferable, as it remains active in the body longer. K2 is safe even at high doses, but those taking anticoagulant medication should consult a doctor. A combined approach for stronger kidneys. These 4 vitamins aren't a miracle cure, but they can help keep your kidneys working more efficiently over time by reducing inflammation, protecting blood vessels, preventing stones and calcium buildup, and promoting more effective natural detoxification. Including foods that contain them in your daily diet, or considering targeted supplements, is a simple but powerful step. Small habits are all it takes: a little sunshine for vitamin D, a handful of nuts for vitamin E, a sweet potato or kale for vitamin A, a piece of aged cheese for vitamin K2. Kidney disease is often silent until its advanced stages. Early intervention gives your kidneys a chance to last longer and function better. Today, you still have the option of choosing foods and lifestyle choices that protect them. It's an investment that can prevent many problems in the future. Please note that this video is for informational purposes only and should not replace medical advice. If you have any questions, please contact your doctor. If you like our videos, please leave a like and subscribe to our channel so you don't miss any upcoming content. See you in the next video.